It is really important as you're healing to inspect your incision every single day. For the first week after surgery, you'll have white tapes on the incision. When we see you for your first post-operative visit, we'll remove these white tapes, and we'll do that for you. It's nothing that you need to do at home. We're also going to teach you at that visit to assess the bottom part of the breast, where the vertical scar meets the fold of the breast. It is very important that you look at that every single day, and I encourage my patients to do that either just before or after they shower. I always want to make sure that the incisional edges are kissing, and if you notice that the incisional edges are not kissing or are not together, please let us know. It is important that you do not apply any heat or ice to the surgical sites whatsoever. I really want you active after surgery, but that doesn't mean I want you hyperactive. Take a nap if you'd like to, but then I want you up walking around. By no means are you on bed rest. That doesn't mean that you're going to go to the gym or you're going to go to SoulCycle or any type of group fitness, high-intensity training exercise week 1. Many times I get the question about what should I eat after surgery? I'm not working out, so I'm concerned about eating too much after surgery. And this is really important to understand that you really have to eat to heal. So protein intake is a very important part of the post-surgical process. Daily hygiene starts with the use of a special cleanser that we've asked you to obtain or have given to you prior to surgery. This cleanser is to be used the night before surgery and the morning of surgery. When you apply this to your surgical site, it is important that you lather up very gently, being careful not to scrub away any pre-surgical markings that may have been placed by me. I do not want you to use this cleanser after your surgical procedure. At that time, I want you to switch to a gentle body wash that has an antibacterial component. This works well on the surgical sites and allows you to maintain great hygiene following the surgical procedure. We don't want any scrubbing or abrasive type of cleansing tool like a loofah or aggressive washcloth or any type of exfoliator during this process, as it may damage the skin. It's really important to understand that I do not want you using any creams or lotions to the surgical site. We'll instruct you when the time is right for you to start your scar protocol after surgery. Ask you to compress your breast in any form or manner. So it's important to understand that if you feel that you want to wear something over your breast, I encourage you to wear a soft bra or a shelf bra after surgery. This can keep your breast protected and make you feel like you have some type of support on. Driving after surgery is very common, but not the day of surgery. You've been exposed to anesthesia, and it's best that you have a driver to safely take you to and from the surgical facility. Once you are off of narcotic medication and muscle relaxers, and you feel like you can drive defensively, that's when you know you're safe to drive. At 6 days after your procedure, we'll remove that dressing, inspect the incision to make sure it looks clean, dry, and intact, and we will teach you how to examine the incision on a daily basis. If you ever see signs of incisional opening or drainage or problems with the incision healing, it is very important that you notify us immediately. So this might be a little bit uncomfortable, but we're going to talk about sex. You can absolutely have sex after surgery, but once you're fully healed. And if you want more details about the specifics of what we feel is safe and not safe after surgery, please ask one of my nurses and they'll go into great detail about this topic for you.